This is an illustration of how nasal airflow works. When we breathe in through the nose, air is supposed to flow nice and smoothly. We call this laminar airflow. When this happens, the nose is able to sense the air. That's how we're able to do very good breathing treatments through the nose, use meditative breathing, and feel the air as it's going in through the nose and then down into the lungs. There are multiple things that can obstruct that. On the inside of the nose, one of the major things is the septum. This is the septum here. The septum can be deviated. When the septum is deviated, you can see how this can cause multiple problems. The flow comes in through the nose, and instead of flowing nice and laminar, it then becomes turbulent. On the other side, it can become obstructed and come right back out, and also be turbulent. Turbulent airflow causes the sensation that we have poor airflow. It can also create inflammation. Between that and other things such as allergies, the turbinates can grow and become very large. When that happens, it also can obstruct airflow. Things like allergies, like I said, can cause inflammation and swelling in the nose. That also creates problems. Septal swell bodies are when the septum is not necessarily deviated, but you can see an enlargement of the mucosal layer of the septum. All these things can cause obstruction. These are all things on the inside of the nose. On the outside of the nose, you can have multiple layers of obstruction as well. We'll start with a base view. As you can see, to start, nasal airflow has to come right through in here through the nose. So, if we have any issues there, that's going to be our first line of defense. Many people are born with a collapse of the nasal ala, such as this. This creates a very small stenosis. If you're trying to get air flowing through this small hole, you get a problem with that airflow. There's a principle called Bernoulli's principle, in which when air is flowing smoothly through a tube such as this, or water, or any medium, that's nice and laminar. If you get this bottlenecking, when air tries to flow through, as it comes into this tunnel, each of these things combine. And when they come out, they don't just swing out nicely. Instead, the air, as it combines in, bottlenecks, and then becomes very turbulent. So, obviously, the entrance to the nasal cavity, or the vestibule, is a very important part. It's composed up of cartilaginous tissue. So, sometimes this cartilage can have a static collapse, meaning it's just smaller. And sometimes it can have a dynamic collapse, which means over time with negative pressure, the cartilage here starts to collapse on inspiration. So when we breathe in, rather than expanding out, there's a paradoxical sinking in. You can also have collapse of the upper lateral cartilage. The upper lateral cartilage is this cartilage here. What we were looking at just now is this cartilage called the lower lateral cartilage. The upper lateral cartilage can also collapse due to negative pressure. Again, this can develop over time. This right here is one of the large targets of breathe right strips. So you've seen those before, a little strip that you wear over your nose. And what that's doing is it's really pulling on these upper lateral cartilages to tent them out. These are the major ways in which we develop nasal obstruction. The total nasal airway procedure is a procedure that I have been developing that can help treat all of these different areas. Using a combination of 4 different procedures, sometimes using all of them, sometimes using only some of them, I can address all of these issues. Let's start with this view here. The first procedure that I perform is something called Vivere. This is a radiofrequency or heat-based therapy. It's used to help stiffen these cartilage to decrease dynamic collapse. Using a wand, what I do is I place it into the nose right here, which I'll show a better view of later, and I get it all the way up into here. And what I'm doing is heating these areas and these tissues, causing the tissue itself to contract and also to cause some scarring and some contraction of this cartilage, and that cartilage will then stiffen. Going back to our base view, doing small heat based therapies and radiofrequency therapies all along here, here, and here, you can tell that if you had a static collapse like this, we would be pushing all of that out this direction to try and help increase the nasal vestibule by a few millimeters each. It also helps with the dynamic collapse of the nasal ala by stiffening that lower lateral cartilage. This is going to help increase our airflow and create a much larger amount of air flowing through this now enlarged nasal vestibule or opening of the nose. Once you get into the nose, I treat this with multiple different ways. Traditional surgery for this is to do what's called a septoplasty and turbinate reduction, which I still use on many, many patients. In a traditional septoplasty, we're generally going into the nose and removing bone and pushing everything into the center. This is going to make a nice open passageway, and still what many of my patients require. And I will also do a turbinoplasty, which we will discuss in just a second. With my minimally invasive total nasal airway procedure, I'm addressing multiple different issues with two different techniques. Number one, you have this deviated septum, and many patients also have what are called septal swell bodies, as well as just generalized inflammation inside the nose. The first thing I do is what's called submucous resection of the inferior turbinates. In doing so, what I do is I enter this pocket of turbinate and remove a small amount of this paper-thin bone. That's just going to weaken the turbinate. Once I do that, I then can place a small balloon called tract inside the nose. This balloon is then inflated very, very large. Once it's inflated to this diameter or large pressure, it's placing a great deal of pressure on all the structures within the nose, which performs three different main functions. Number one, the weakened turbinate will outfracture. Once it's outfractured, what you're left with is a turbinate that's much more like this in size. It also creates, instead of this convexity, it will create a balloon concavity. This allows for increased airflow once it's inside the nose. Because we're performing a submucous resection, all the mucosal layer is intact. Because all the mucosal layer is intact, the sensation of airflow continues. That's how we avoid the symptom of empty nose syndrome. Secondarily, what this balloon dilation causes is a pressure necrosis of all these inflammatory cells. In some of our best studies on the eustachian tube dilation, we found that by inflating the balloon for up to 2 minutes, or for 2 minutes, we cause a pressure necrosis of all of these inflammatory cells, and over the course of about 1 month, they start to slough off and die. This has a lasting effect. For those patients with general allergies and other inflammatory diseases, this is a very helpful portion of it as well, as we're decreasing the inflammatory process. Lastly, the balloon helps address the deviated septum. Rather than removing all the bone, this causes a controlled fracture of the septum, and the balloon places the septum back into midline. There are some patients where this is not appropriate or won't be fully functional, but there's a very large amount of patients that a balloon septoplasty can be more than adequate. If there is a small bony spur, something that cannot be fractured over, I can address that individually using a small microdebrider that I use for the turbinates and shave this bony spur down in a controlled fashion. By addressing all of these different aspects of nasal breathing, I can increase the nasal airflow, help improve laminar airflow, and allow for much improved breathing, all in the setting of the office without having to undergo any general anesthesia. It's a very tolerable procedure.